My radiation oncologist recommended that I attend hyperbaric therapy for the purpose of regenerating some of the damaged cells that were damaged while I was having radiation therapy for throat cancer. That was the best chance of having that regenerative process take place. For me, it was predominantly my saliva glands and regenerating those.
Well, the two streams of hyperbaric medicine is, one is for the acute stream of diving related injuries, which most people are familiar with. Hyperbaric's used for that. But of course there's the iatrogenic injuries where people are exposed to bubble loads through, for example, central line catheters being left open and in streaming of bubbles into the venous system of a patient. And the other big group of patients that we treat are the medical chronic wound type patients, so patients with venous wounds, arterial wounds, diabetic wounds. Hyperbaric medicine's been around for a long time, and basically it's the provision of oxygen at depth, at a pressure. And so in a hospital facility like this one, we're using pressures of somewhere between 14 metres seawater pressure up to 30 metres seawater pressure. The room's set up so you can have up to 7 or 8 patients treated at one time. The room itself is compressed and taken to the treatment pressure, and then the patient puts oxygen on via a hood which has an elasticated bottom so that there's no escape of oxygen into the room.
The hyperbaric unit is very, very professional, very thorough. So that gives, as a patient, that gives you a great sense of confidence, I think, when you're coming in here. And aside from that, they create a very jovial, relaxed atmosphere in here as well, which I think that transfers through to the patients as well. That puts everyone at ease, especially when you're first coming in as a new patient, because you're wondering, you know, what it's going to be like.